Hello. Today I'm going to be presenting information about healthcare, communication, and professional writing. My name is Rashina Purnell. In this presentation, I will talk about the information that I gathered from 2 interviews, and I'll also talk about information that I gathered from online sites. And there will also be pictures and some definitions of different types of technical writing skills. Things that will be covered in this PowerPoint presentation will be to inform the reader about certain healthcare communications, some of the responsibilities of nurses to the patients, what the physical therapist does on a daily basis, types of documentation, and definitions of words. Professional writing is a communication used in most workplaces and allows professionals to make informed decisions. Professional writing is usually in a formal tone, and it's different from text written in books or something you would want to read for entertainment. The purpose of technical writing or professional writing is to persuade, instruct, to encourage action, to inform, and to share goals. Different types of professional writing. The first selection to your left, I'll talk about the interview I did with a nurse named Laura. I basically asked her what were some of the daily charting that she does in her 12-hour shift. She basically told me that she does skin assessments, she fills out reports, she charts any changes that may occur with the patient, whether it be small or major. She'll also document whether she had to contact the doctor. That could be from if the patient was having pain and they needed something prescribed but it wasn't in their med list, they would have to contact the doctor and get an order for it, and then that would be processed through the pharmacy. She also said that she basically has a checklist that she has to do, and she has to check off whether it was done, and sometimes if it wasn't done, she may have to write a comment, because sometimes patients refuse, which they have the right to, so she just have to document refusal of the patient, and maybe a little comment of why the task didn't get done. And then also in a hospital setting, patients tend to stay, depending on the diagnosis, the patient can stay from 1 day to a week, 2 weeks. But then when it's time for the patient to get discharged, the nurse has to do discharge paperwork, which that entail when to take the next medications, if they have a wound or a surgical site, whether to not get it wet or not, or to use a topical cream, or just soak it. They just have directions on what the patient should do once they get discharged from the hospital. The next person I interviewed was a physical therapist, his name is Richard. I asked him what was some of his professional writing skills on the job, which he works 12-hour. Well, I think physical therapists work 8-hour shifts. But he said that he reads notes from the doctor. He also writes evaluations, which that consists of a workup to making notes on what exercises needs to be done with the patient. They'll make notes of the patient diagnosis. They'll write recommendations for the patient, whether they need to go home with physical therapy, which will be set up with home health, or would they need to go to a rehab and get rehabilitated so they can get back to home and do their regular activities of daily living. And they also make notes whether the exercise they did with the patient was tolerated, or if they're safe to get up with nursing staff or not. In this slide, I just have some charting tools that the nurses might use. The first little picture I have, it's just a wound assessment. Nurses do skin assessments as soon as the patient arrives to the floor, or if it's the beginning of the shift or throughout the shift, they keep an eye on all their patient's skin, make sure they don't have any wounds or breakdowns. If the patient's bedbound, they have to be turned every 2 hours. If there is a wound or some kind of sore, the nurse also has to document it. They have to get the pain level from the patient if the patient's able to describe it. They sometimes also have to get the length and the width and the depth of the wound if it's that bad. And to the right, the two pictures I have is just a nurse brain for them to jot down notes as far as the patient's name, the age, the date of the day, what medications were given, vital signs, just current information they need to look out for their 12-hour shifts to make their day successful. Some of the tools that physical therapists use would be a whole anatomy of the body. It's a pain assessment. Pain is scored from 0 to 10. They might circle an area on the body that is injured and needs to be exercised, or certain precautions that might be needed to work with the patient that day. And the bottom two pictures are just basically another way to jot down notes so that when they actually have to chart, they can use the piece of paper and chart it into the computer system, because everything has to be charted. Healthcare communication. Healthcare communication is basically verbal speech or another way to relay information to get a point across. Healthcare workers need to use this so they can communicate to each other, so that the patient's stay and care can be coordinated and go smoothly. Some examples would be like if a patient expresses that they're in pain, the nurse has to comprehend and be able to get pain medication or inform the doctor so that their pain can be managed. Also, nurses and clinical staff should educate the patient on things they should try to do to better their health, so they don't have to keep coming back to the hospital for reoccurring issues. And just everybody has to be in communication so that the shift can run smoothly. Communication between the nurse and the physical therapist includes an appropriate time that the physical therapist can work with the patient, because sometimes the nurse has to give medications so that the patient's pain level is under control and they can tolerate exercise from the physical therapist. And they basically just need to communicate, because physical therapist has to check with the nurse before they can actually work with the patient, because at that current time they want to work with the patient. It might not be appropriate, so they might have to come back later, or they might have to come back the next day. The nurse's responsibility is to provide instant medical care, monitor patients' conditions, collaborate with physicians, do routine procedures, which would be injections, vital signs, and the nurse has to also interpret and observe patient symptoms. And they also have to be compassionate and supportive to the patient and the family, because nobody wants to be in the hospital, and you really have to have compassion for people that are really sick, because it takes a toll on your mental health and your well-being, and you just have a lot of things running through your head. So it's very important to be compassionate and supportive. The responsibilities of the physical therapist, they are to delegate jobs to the physical therapist assistants. They have to supervise, make up a plan of care for the patient. They have to make decisions on whether the patient is safe to transfer and what equipment should be used when getting them up and down out of bed. And they have to help the patients regain mobility. And the conclusion of this presentation, with the research that I gathered as well as the interviews, I realized that both positions are very important, and that nurses and physical therapists complement each other. And at the end of the day, every position in healthcare is just as important as the next. And all that is needed to make the job successful and to flow accordingly is good communication and professional writing skills. And I just want to thank everyone and my teacher for tuning in to my PowerPoint presentation. And I also don't want to forget my reference page. These are all the sites that I gathered information, and I also use references from the pictures that I got offline too. So thank you.